Hello, welcome to Chapter 5. This is Physical Environment and Safety Standards. The OR can be a pretty dangerous place if you're unaware of your surroundings. This chapter is going to help keep you, your patients, and your team members safe throughout the experience. So let's get started. We're going to start with areas of the operating room. We're going to start with the unrestricted areas. These are areas that street clothes are allowed. So this would be for patients, basically. Entering the hospital, before they go in, they can go into the atrium where there'll be cafeteria and information. They can also enter pre-op, which is where patients go to get ready for surgery. They can go into, staff can walk into the locker room to get changed for surgery. So PACU, post-anesthesia care unit, which we also refer to as recovery often. This is also an unrestricted area because what happens is patients come in street clothes, into pre-op. They change into a gown. We take them into surgery, which we're going to talk about in a second, is a restricted area. Then they come back out to recovery or PACU, and they're going to change back into street clothes. So we need this area to be unrestricted to have access for the patients. So our semi-restricted areas would be decontamination and assembly room, central supply and processing department, hallways here outside of the OR suite itself. These are semi-restricted areas. So a patient couldn't just walk in through these double doors in street clothes. They would have to be, all these areas should be marked so that people have scrubs, caps, and shoe covers on in this area. Now, our restricted areas are once you enter that OR suite. It's also would be an inner core or substerile room. These areas are restricted areas, so you have to have all of your OR attire plus the surgical mask. One quick thing I want to mention is about environmental services. You'll see them. They have to be dressed in the full OR attire with masks as well. They handle the cleaning of the department and will clean the OR suite in between cases. These are called turnovers. So a big thing in the surgery is turnover time. How quickly are your turnovers done? So always feel free to help out with environmental services. You can make a bed, you can help sweep a floor just to keep that turnover to an efficient time. We're going to talk about components within the operating room. These are the different things that you're going to see within an OR suite. A couple things I want to mention: gas outlets. Make sure that you know what color identifies each gas. Nitrous oxide is blue, compressed air is yellow, oxygen is green. The ventilation system in the OR suite. This is very specific. This is a unidirectional positive pressure ventilation system. So what that means is we go in one direction, unidirectional. It goes through this filter, so clean air enters the operating room, and then the contaminated air exits the room in this same direction, okay? These exchanges of air have to occur at a minimum of 15 air exchanges an hour, which is about every 4 minutes. You're going to have a fresh, clean air burst in and the contaminated air go out. So that would be every 4 minutes at 15 an hour, minimum of 15 an hour. The pressure that's going to be kept in this room is positive. This means that when the door opens, a burst of air is going to rush out into the hallway. Just like a balloon has positive pressure. So if you pop a hole in that balloon, all the air is going to rush out. We want that because the hallway, remember, people are walking around without masks on. We don't want those germs to come into the room. So positive pressure helps push all of the clean air out and keep the contaminated air outside. Doors help us to keep that positive airflow. They're a real essential part of the operating room. Those doors have to remain closed. So if you forget something in an operating room, you don't walk back in. You have to call in there, ask the nurse if it's okay for you to come in. You might have to wait until the procedure's over. You never walk through an operating room, especially an opened with sterile supplies. You never walk through that room. Anytime you open the door, we're losing positive pressure. So if that door remains open, that pressure is lost and all the contaminated air can come in. So keep doors closed at all times. What you see here is called a boom. This is attached to the ceiling. It's mounted to the ceiling. It has articulating arms, and it holds multiple shelves that basically whatever you need. This is probably a laparoscopic boom, so it'll have a light source and a camera. You could have an arthroscopic boom, but it's going to contain equipment that we use regularly within the room. Okay, some more components here. We have a table. Something about the operating room table that you should know. It does have brakes in the table that it can move. So this whole leg piece can move down. This brake here is at the knee. We have another brake at the waist and one at the head. The head is always this small piece. Okay. The one at the waist is good for like a nephrectomy if they need to bring this up and flex the patient. This here is a Wilson frame. It's used for the prone position that you see right here. This frame, if you can turn the handle and it will bring the bars, the arches up higher or down lower. This right here is a Mayfield headpiece. This is for a craniotomy. This attaches to the table and then attaches to the patient's skull. It keeps the patient very still during a craniotomy. This right here is a urology table. It has a radiolucent top so you can take x-rays, and also has a fluid drain pan here, so for all that excess fluid so we're not making a mess on the floor. Other equipment, your back table. We know that back table is used for sterile equipment and to open supplies on. Your Mayo Stand. We know that this is used as your main place for instrumentation throughout the procedure. This Mayo Stand is the most proximal to the patient. Remember that proximal means closest to the center of the patient. Some other things of note, an eraser board is a big deal now in the OR. You'll usually see them on the wall in the background. They're in a place that everybody can see. They'll have markings where we'll record sponge counts, sharps, staff names can be placed on there, or position. If it's a right side or a left side, you can also find on that eraser board. Okay, hazards. We have 3 types of hazards in the OR. Physical hazards, biological, and chemical. So when we're discussing physical hazards, one of the big things to be concerned with is ionizing radiation. Now, while this can have therapeutic effects like the treatment of cancer, it also can have very harmful effects, and that's really what we want to focus on right here. Ionizing radiation causes changes in the cell membrane. So this breaks down a cell. So this also can cause changes that will lead to cancer in healthy cells. So we have to protect ourselves. This right here is a C-arm. This is used in the operating room. This is probably what you will see the most frequently in the OR as a tech. This is the piece actually gets draped, and we'll see it on the next slide here. Goes up to the patient. You can do an AP and or a lateral shot, and then it shows up on the screen over here. The way to protect ourselves from this ionizing radiation in the OR is through time, shielding, and distance. So time meaning that we're going to be careful about how much time we spend in a C-arm. If it's run constantly, the doc wants to shut it off in between shots. Don't just leave it constantly running. Shielding, everybody in that room must wear the lead aprons that you see here. You also need a lead thyroid shield. That's part of the deal. One should not go without the other. You should always use both. That's put on before you put on your gown. So before you scrub, make sure that you have your proper gear on. Distance, you should always stay as far away from possible as from the x-ray machine. Sometimes that's difficult, but you got to do the best you can to keep a little bit of distance. We also have electrical hazards. So William T. Bovee invented the ESU in 1926. This is a Bovee, like we shortened it to his name, or an ESU unit. The generator produces the electricity, follows through the cord into the pencil on the tip, cuts the tissue, that electricity always has to continue a circuit. So that grounding pad has to be correctly placed so that electricity can go back through the grounding pad and back into the generator. This works very similar to like a 3-prong system where you have your top 2 prongs, electricity is supplied through here, and then that 3rd prong is the ground. So it's that same concept with the bovie, and that grounding is just essential to its function. So fire hazards, another physical hazard would be fire. In fire hazards, what you have to have for fire is this fire triangle. There's 3 components that have to exist in order for a fire to occur. You have to have ignition, fuel, and oxygen. Your ignition is going to be anything from your bovie, your ESU, your lasers, defibrillators, sparks from static electricity will cause a spark. The fiber optic cord in a laparoscopic procedure gets extremely hot. These are all ignition sources. You also need a fuel. All of our drapes are extremely flammable. That's a fuel that can keep a fire going. And an oxidizer would be our anesthesia gases. We have a constant flow of oxygen coming in. This is why any procedure that's done on a patient's face or airway has a higher fire risk, and it should be acknowledged to be extremely careful with your ignition sources, because devastating fires can occur within the airway. With fire hazards, this is something you're going to need to know for this exam, for the certification exam, for your career. You need to know the class of fire extinguisher, A, B, or C. You need to know what it consists of. Is it water, carbon dioxide, or halon? And what each puts out, okay? There's a little poem on the bottom here. Fire made of wood or paper needs water to subside. Liquid, oil, and gas only use carbon dioxide. Electrical or laser fires are put out with halon. Use past technique when putting out each and every one. You can try to... come up with a better poem, please, that helps you to remember this, or a better mnemonic that helps you remember this. But this is one of those, excuse me, one of those items that you're going to want to really try to bring to memorize this. Okay, I know I hate using that word, but it's true. You're going to have to memorize that one. Also know that PASS is used, that acronym is used specifically for fire extinguishers. Physical hazards, going further on with fire hazards. The RACE method is what we use within the hospital. This is an acronym for remove, alert, contain, and extinguish. Make sure you see this little badge here. This is something that is almost on everybody's badge when working in the hospital. And that's been in every hospital I've ever worked with. So RACE is what you do during a fire. Excuse me, coughing. Okay, we're going to go to ergonomic safety. Ergonomics is how you can hold your body and things you can do with your body to promote safety. So something for surgical technologists, we have a problem with lower back, knees, feet. You want to make sure you're using proper posture and body mechanics, and this is going to help you. You know, at the end, I have a problem with this. At the end of the day, my back will be killing me, my lower back. This is pretty much how I look. My neck will be shot as well. You want to maintain a nice straight posture, and it's just going to help you be able to keep that position throughout the entire day without having too many effects on your body. The lights. The reason the lights can be a hazard is while they're supposed to be non-glare, they do emit a blue-white beam, and it's supposed to be like sunlight that shows true color. So you can tell the difference between an artery and a vein, let's say. But with that sunlight, you got to be cautious that you're not staring too long into the light. It is a bright light, so you want to make sure you're avoiding eye fatigue by being cautious with the lights. Biological hazards, this would be things of concern like latex. We wear latex gloves. These gloves are made from natural rubber that are harvested from trees. So with anything natural can come allergies. 8 to 17% of healthcare workers are allergic to latex. So this is something that some of you could be dealing with. Things to be aware of. Now we have two types of allergies, allergic responses. You have type 1 and type 4. Type 4 is not as dangerous. It's what you see right here. Skin irritation, discomfort, but it is extremely uncomfortable. If you have this, you're going to want to switch to a latex-free glove and just kind of take good care of your skin. Make sure that you're using lotions and anti-inflammatories to make sure that you're not getting to this point. Type 1 is our most dangerous type of allergic response. This is the most serious reaction, and it could be a respiratory reaction. Another hazard we have is surgical plume. This is from cauterized or coagulated tissue from a laser or an ESU or bovie. So this is like what you see here, the smoke, bovie smoke. Anything, a bovie, it can be used with a regular suction. We can get rid of that smoke through regular suction. With a laser plume, we have to use a special evacuator that has this HEPA filter on it. The HEPA filters filter particulates from 0.1 to 0.5 micrometers. So this system would be disposed of after the case. It would come with a sterile tip. That wand, you want to make sure you get as close as possible without getting in the way, because if you're within 1 centimeter of that impact, you'll evacuate around 98% of that plume. So you're getting rid of most of it by being as close as possible. Sharp safety. This is going to be something we really practice in lab. A neutral zone allows the safe transfer of sharps. So it's basically an agreement between you and the surgeon of a space that you're going to place sharps without a lot of hand-to-hand contact. So your hand isn't going to be resting in that neutral zone when he or she goes to pass back a scalpel, okay? If you do get exposure to a sharp, if you get stuck by a hypo or a blade, you do need to have appropriate post-exposure prophylaxis. This is, anytime that happens, what you're going to do is tell your nurse immediately that you've been stuck. They will take blood from the patient to test for HIV and hepatitis B. They will send you to the ER or actually have a protocol where somebody comes and takes your blood for a baseline draw of your blood. After the testing comes back from the patient, whether that patient did test positive, they may start you on a course of medication that will help you prevent acquiring those diseases. Hazardous waste disposal, we are going to use the red bags for blood and body fluids. So make sure everything goes in there, and then you're always using gloves when dealing with these bags. Chemical hazards in the OR. Any material that you come across that could be, actually any chemical material has to be included in our material safety data sheets. This is the MSDS. Every department must have one, and it has to be available to personnel. So it may be online or it may be a book that's in the department, but it contain every chemical that is used within that department. Another concern is the waste gases from anesthesia. Anesthesia has a gas scavenging system so that it will remove waste gases, filter them before sending them back into the atmosphere. Another chemical hazard would be our polymethyl methacrylate, PMMA. This is also called bone cement, and actually more frequently called bone cement. It comes in separate powder and liquid materials that you as the tech will actually mix. The gases that release can be toxic, so that if you are pregnant, you are not to be in these rooms mixing cement. There's a ventilation system that's used when mixing cement. You're going to be aware of how much time you spend in those rooms as well. Formalin is also another component used on a daily basis. This is used to preserve tissue for specimens to be sent to pathology. So that's something that you're going to have a lot of access to. If there is a formalin spill, you do want to refer to MSDS on how to clean it up. Our regulatory agencies, this is the last thing we'll cover. These are, you're always going to have a bunch of these throughout the program that we're going to talk about. OSHA is one that's going to come up over and over. This is a federal organization, and they are there to protect the health of all workers. National Institute for Occupational Safety and Health, they are an arm of the CDC, and they set guidelines for permissible exposure limits. So they're going to be the ones to tell you how long can you be in X-ray for, or how long can you be exposed to ETO, so that you're not being abused in the workplace, basically, by being exposed to this stuff too much. Another agency to know of is AMI, or Association for the Advancement of Medical Instrumentation. They're involved in all areas of healthcare, but we're going to see them mostly with sterilization, electrical safety, use of medical devices. So they offer guidelines on proper care of these items. That's about it for Chapter 5.